It's a very deadly disease. The American hantaviruses and this Andes virus can cause up to 50% case fatality. So that's about half of the people who get infected could potentially die. That's the upward end of that, but that's much higher than what we see with a lot of other respiratory infections. Sagan Friant, Assistant Professor of Anthropology and a co-hire of the Huck Institutes for the Life Sciences. Hantaviruses are a group of viruses, rodent-borne viruses, and there's several different hantaviruses, both in the Americas and in Asia and Europe. So the ones in Asia and Europe attack the kidneys, and the ones in the Americas, like this Andes virus and Sagan virus, which is in the Four Corners region of Northern America, attack the lungs. So what makes this in the news and very different from what we've seen before is that hantavirus has spilled over into a human, and typically hantaviruses don't have human-to-human transmission. So they spill over to a human, which is what we call a dead-end host, and then there's no subsequent human-to-human transmission, except for one strain of hantavirus that's known to have human-to-human transmission, the Andes virus, found its way onto a cruise ship full of people from across the world in close contained area, which allowed for sustained human-to-human transmission. And so now we're seeing multiple cases. There's been hantaviruses are spilling over from rodents into humans all the time. Just this year, there were signals of this in Argentina. There was an increase in the number of hantavirus cases. So people are getting infected with this hantavirus regularly in this context. So the difference is not that people are getting infected. It's the human behavior surrounding this infection, and that they brought this into the global setting onto this cruise ship. And so that is a surprising element of it, but this spillover from rodents is something that we see often. We never expected for a hantavirus to get on a cruise ship, which is a little bit different, but it provides this close, sustained contact that this certain virus requires to be transmitted. So we're talking about people who are living in the same area, who are sharing items, breathing on each other, very close contact. It's not something that's spread casually like we would see with influenza or the coronavirus. The thing that I think is very emotional and very operationally challenging about this is also the incubation period. And so the hantaviruses have a long incubation period, and so that's the period in between which a person gets infected and then when they start exhibiting symptoms. And so for most respiratory diseases, this is about a couple days to a week. For a hantavirus, it's 1 week to 8 weeks. So this means that this isn't ending soon. These people need to be monitored for about 2 months from now, in which they might develop symptoms. And that's a long time for somebody to wonder if they're going to get a deadly virus, and also for us to monitor whether there's onward transmission. I think a lot of what is causing panic and urgency is we talked a little bit about how this is very reminiscent of COVID. And I think a lot of people are getting confused between this idea of an incubation period and an infectious period. And so COVID was really unique in that people were getting infected prior to exhibiting symptoms. And that's pretty rare among a lot of infectious diseases. And so we wouldn't expect in this scenario for people to be infecting others unless they are feeling sick and exhibiting symptoms. And so when we say that there's an 8-week incubation period, that doesn't necessarily mean that people are silently spreading this infection throughout those 8 weeks and on this cruise ship. So hopefully some of that clarity can help reduce some of the anxiety around this amplification of another zoonotic disease.